Hi, my name is Ivy Elkins, and I am one of the co-founders of the EGFR resistors. I will be speaking today about treatment patterns in patients with EGFR positive lung cancer, a real-world patient report. These are my disclosures. Understanding what treatments reach which patients in the real world is critical. However, it is often difficult to get this information because of how data on treatments are collected within different hospital systems, both here in the United States and globally. Patient reports of treatments can help fill this gap. Through Project Priority, a joint study with the EGFR Resistors and Longevity Foundation, we gathered this data directly from patients diagnosed with EGFR positive lung cancer. In the following slides, I will talk about what we learned about real-world treatment sequencing for these patients. In 2019 and the beginning of 2020, we surveyed patients diagnosed with EGFR positive lung cancer and their caregivers to understand their experiences with treatments and side effects. We had 425 respondents for our baseline survey, and 127 of those respondents also completed a 6-month follow-up survey. The baseline sample was 78% female and 67% were under 65 years of age. The majority of respondents were from the United States, and about half had been fairly recently diagnosed. As you can see, since first-line osimertinib was FDA approved in early 2018, use of osimertinib as first-line treatment for EGFR positive lung cancer has increased significantly in the United States, with almost all respondents being prescribed this medication in 2019 upon diagnosis. However, outside of the United States, earlier generation TKIs such as erlotinib, afatinib, and gefitinib are all still commonly prescribed as first-line treatment, clearly shows an access to osimertinib that exists in many places outside the US. We also looked at the treatment trajectories for patients with stage 4 EGFR positive lung cancer who have been on multiple lines of therapy between 2015 and 2020. This is a Sankey diagram, and the solid colored bars represent proportions of participants on specific treatments. 106 patients were included, excluding those who were still on their first line of therapy. The variability in treatment sequences show that while many patients who started on erlotinib and afatinib moved to osimertinib as a second-line treatment, not all do. Since 79% of the patients with treatment trajectories on this figure are from the United States, this represents more than the access issue that we saw on the previous slide for first-line treatment. Instead, this suggests that guideline-adherent care is not being given to all patients in the United States. It is notable that with similar time since diagnosis, 95% of patients prescribed osimertinib first line were still on this treatment at the time of the survey, compared to 28% of patients prescribed erlotinib. Patients reported their most common first-line therapy side effects for erlotinib, afatinib, and osimertinib. Generally, while patients on osimertinib often experience the same side effects as those on earlier generation TKIs, many report these side effects as mild, as opposed to moderate or severe. If we take diarrhea as an example, we can see that over 3/4 of the patients who are on afatinib first line reported moderate or severe diarrhea, and so did about half the patients on erlotinib. This compares to only approximately 1/3 of patients who reported moderate or severe diarrhea with first-line osimertinib. Thus, it is critically important for guidelines for patient care to be followed so that everyone who is eligible for osimertinib can experience the best possible quality of life. In summary, to our knowledge, this is the first real-world report of treatment sequencing of EGFR positive lung cancer in the era of multiple TKIs. Despite the relatively recent diagnoses of our study participants, our analysis highlights clear disparities in all lines of treatment where recommended guidelines are not being followed. Newer generation TKIs seem to provide longer time to progression and better tolerability based on the most common side effects experienced by patients. Thank you.